Welcome, Dr. Shetty, to another episode of Editor Speaks. What is the importance of pre-anesthetic check-up before an intervention or a surgery?
Pre-anesthetic check-up play a very big role in any success of any intervention or surgery. One, it decides on the success of the surgery. Two, it decides on the type of anesthesia which requires to be given. Three, it decides on whether the patient can withstand the surgery as such. And four, if there are some abnormalities or abnormal reports, it can be corrected before the surgery, before it causes complication. And five, there are times when certain abnormalities cannot be corrected. Low ejection fraction indicating a weak heart, poor lung capacity indicating a weak lung. At such times, the anesthesia cannot be given, the surgery cannot be done, and the patient can be declared unfit and will have to be managed conservatively.
So, what should a doctor do differently in case complications arise, in spite of doing a normal PAC?
See, we should be very clear. Medicine is an imperfect science. It cannot be described in black and white. There are shades of grey. The anticipated results and the final results need not be the same. There was a judgment from the Supreme Court wherein the patient was diagnosed with Chiari's malformation type 2 with hydrocephalus. He was operated on successfully. Patient was transferred to the ward. By evening, the patient became breathless, diagnosed with a myocardial infarction. Patient was transferred to the ICU, put on ventilator. The patient died after 50 days. The relatives alleged negligence. The court made many observations. One observation which stood out for me was the observation of the court that the complication was unrelated to the surgery performed. The court went on to add that there was no cardiac ailment or cardiac disease detected during the pre-anesthetic checkup. Hence, for this reason, the court did not hold the neurosurgeon negligent. But supposing there were certain reports like a ECG showing some changes or a 2D echo showing some changes which could have indicated a cardiac disease, and if the anesthetist or the surgeon had not taken the opinion of a cardiologist, the court could have been harsh. But since the reports were normal, the court did not hold the neurosurgeon negligent. This is what was important in this case.
So, are there any exceptions where an intervention or a surgery can be performed without doing a PAC?
The exceptions can be emergencies in the interest of saving a patient's life. But here too, the basic investigation had to be performed. But if it is an elective intervention, there are no exceptions. All the things mentioned in the medical text have to be performed before an intervention is done.
So, sir, what would be your key take-home message?
See, pre-anesthetic checkups are necessary for the success of an intervention. So it should be done with due diligence. The result should be interpreted in a correct way. If there are some things to be corrected, it has to be corrected before the surgery. If there are some abnormality for which a opinion of appropriate specialty has to be taken, it has to be taken. If any shortcuts are tried, if something is done in haste and some complication occurs, the courts can be very harsh with the anesthetist, the surgeon, and the hospital also for not following protocols or keeping protocols in place.
Thank you, Dr. Shetty, for your valuable inputs.
Thank you.